Welcome back to Go Ask a Nurse, where we dive into real conversations with professionals who are changing healthcare with compassion, knowledge, and innovation. I'm your host, Anna Marie, a nurse, educator, and advocate for empowering patients to take charge of their health. Today's episode is a very special one. We're talking about a field of medicine that has been practiced for thousands of years and is still helping patients heal in new and powerful ways: acupuncture. Today, joining me is Betsy DeGrandi, an experienced and deeply compassionate acupuncturist. Betsy, welcome to Go Ask a Nurse. We are so happy you are here today with us. For those listeners out there who might not be familiar, how would you explain what acupuncture is and how it works?
Acupuncture is about 2,000 years old, but it has a very modern science application behind it. It's non-invasive, natural, and can be an alternative to pain medications, alternative to different types of Western modalities, or just an add-on with Western modalities.
So what kind of conditions or symptoms do you find acupuncture that helps treat most effectively?
Acupuncture is most known for pain, acute pain, chronic pain, autoimmune pain, but we do treat myofascial pain, neurological pain, inflammatory pain. And each one of those comes under what's called the ischemic complex. And I'll kind of explain how that works. When we treat all three of those, basically most of the points that we pick are going to be motor points. You put a needle in a motor point. Motor point is the belly of a muscle. You can also put the needle in the origin insertion of a muscle. But when you do that, the fibers pull away from the needle, and that induces a relaxation response. So we're kind of forcing that muscle to relax. That breaks up what's called the ischemic complex, which then the patient kicks in their own anti-inflammatories called enkephalons, more blood flow, blocks sensory nerve pain to the brain to tell the brain it's in pain. So all that happens during one needle with one motor point in acupuncture. There's a lot of other systems. That's one system. I also do what's called the auricular system, which is the ear system. They're tiny needles in the ear. When you put a needle in the ear, it traces the auricular nerve that goes to the part of the brain that controls the alert system. So it calms down the hippocampus, amygdala, and thalamus. It lights it up, calms it down. That's really good for pain, but it's really good for PTSD, depression, anxiety. That's called the auricular. We also do lymphatic flush treatments. We just trace the lymphatic, basically, the meridian along the legs, the arms, the belly. The other thing that we do is acupuncture can cause decreased nerve pain, but it can also get nerves to communicate together. So that's a little bit different approach. And that's more for neuropathy, because neuropathy, it could be pain, but it can also be the nerves are not communicating. So that's a different kind of treatment, but we're just trying to do a distal and a local, and then the transmission of the neurotransmitters try to communicate. So it's complex yet very simple. So it is a physiological change with the acupuncture needles.
So there's a lot of confusion out there. Can you explain the difference between acupuncture and dry needling?
Yes. So dry needling is, there's a couple differences. Dry needling only does trigger points. Only. So trigger points is basically a balled up muscle, tendon, or ligament that has a little bit of scar tissue on it or fibrosis. It's kind of a fibrotic adhesion. And a lot of people come to, you've heard the expression, oh my gosh, I have a knot in my back. So that knot is basically a trigger point. So dry needling gets in there with a pretty heavy gauge needle, and they're trying to break up those adhesions. And that can take 30 seconds, 1 minute, 2 minutes, and then they're done. There's no retention time. So if I came in, I had dry needling, I might be sitting there for just a couple minutes, that treatment is over. So they only do the trigger points. Acupuncture, we do trigger points also, but that's just one thing we do. We focus more on the motor points, which I just explained. And then we focus more on the emotional aspect with the ear, with the auricular. We do lymph, we do neurological. And then my retention time is usually 20 to 40 minutes because I want a long retention time with the needle because I want the chance to get those dopamine, serotonin levels really high for the patient for relaxation, which you don't get that with trigger point. And that's the difference.
And then the needle size, because I have done both. Dry needling is a little more painful.
Yes.
And I think people come in with acupuncture thinking that they're going to have these big needles.
Yes.
With a big gauge go in, and they're not. They're very tiny.
They're tiny. And if people know gauges, 36, 38, 40 gauge, and that's tiny. And they're also they're not needles in the true sense. They're solid, sterile wire. And they're so tiny. Sometimes when I show patients the needle, they can see the handle, but they can't even see the needle. It's almost like human hair. It's so fine. And then obviously a Western needle, they're going into something, usually a vein. And those are like 18, those are much, much bigger because they're trying to pull something out, fluid out. So yes, it's not even a needle in the true sense.
Well, I just wanted to clear that up because it can be scary.
Yes.
Going in, and maybe that's why people haven't looked much into acupuncture.
Yes.
And understand the true benefits.
Yes.
I know it's really helped me going to see you multiple times on having sleep problems and just the chronic pain from a car accident. So it's been definitely beneficial. So thanks for clearing that up. If someone's never experienced acupuncture before, what should they expect during their first session?
First session, so we do an initial intake, and then I typically go over what's going to happen during the session. And then the room is dimly lit, and there's nice music. It's a heated table. And I'll start with a little bit of acupressure, sometimes a little bit of massage, and then I do a couple needles. And most of the time, the patient doesn't even know I did a needle. They're like, when are you going to start? And I said, oh, you already have a couple needles in. And then the patient lays there for, again, anywhere from 20 to 40 minutes. I can be in the room or out of the room. That's the patient's comfort level. If they're a little anxious in the beginning, I will stay in the room. Otherwise, I let the patient relax. I check on them every couple minutes. When that serotonin dopamine kicks up, most patients are so relaxed, they're napping or almost napping. And then that melatonin kicks up too. So most patients fall asleep. And then after 45 minutes, I just tell them to hydrate and get a little snack. And so the appointments are quite relaxing.
I'm trying to remember how many times you've come in and I've been sleeping.
Yeah, it's pretty typical. Yeah.
So how many sessions would you say that someone needs to get the benefits of it?
It depends on what they're coming in for. So if it's an acute problem, say they overdid it running and they have a muscle spasm. If it's an acute problem, that's usually 4 to 6 treatments once a week for 4 to 6 weeks. I might do 2 times a week, but that's usually like 4 to 6 treatments total. And then that's resolved, or they might, at that point, it's resolved enough, then I'll refer to massage or PT. The chronic conditions are most of that patient population I will do once a month. And I do it once a month so we can stay ahead of the flare or as a preventative or just maintenance. And then at the cancer center where I work, some of the cancer doctors are having me, if they prescribe 12 chemo infusions for 12 weeks, 1 time a week, then I will see the patient for the same schedule. So they get an infusion and then I either see them before or after. I typically will see them after. That helps with their nausea, hopefully, or preventing neuropathy, helps with their energy, and then their appetite. That's big. So for a active cancer patient, a lot of times the doctor will give me a script, and I go with that script. But we found that's really helpful for those patients. And so it just depends what the patient's coming in for. I have patients that come to me just for stress, and we might do that once every 2 weeks or just as needed, just for a deep relaxation treatment.
Well, it's definitely relaxing. And one thing, if you all don't know out there, look into your insurance. I highly suggest that because some insurances really do cover a certain amount of acupuncture or chiropractic. They kind of have it mixed in there. And so my insurance, I'm with Blue Cross Blue Shield, and they do cover acupuncture. So that was extremely beneficial to know. From a scientific perspective, what's the current understanding of how acupuncture actually works in the body?
Everything that I just explained about the motor point and breaking up the ischemic complex and then the ear acupuncture, that's all been measured with modern medical devices. So they measured things with MRIs, Doppler studies, blood composition before and after, thermography, nerve conduction test, objective measurements, subjective feedback from the patient. And I just found out recently there's 10 There's been 10,000 acupuncture clinical double-blind studies across the world. So there's already been 10,000. And so you can Google anything. If you put in pancreatitis, if you put in IBS, if you put in back pain, and acupuncture, if there is a clinical trial, the data will come up. There's a lot of ongoing clinical trials. All the cancer hospitals in the nation have multiple clinical trials going on at the same time. Pretty exciting at Bryan Health. We are going to do sometime this year, we're going to set up our own clinical trial with acupuncture and neuropathy patients. And so we are also going to run our own clinical study, but we're also, acupuncture is backed up by the NIH, the WHO, and then the American Medical Acupuncture Association, which is mostly what MDs, when they get their acupuncture license, they become certified, not licensed because they don't need to go for another 3 years of school. So they become certified. So a lot of organizations, we've been recognized by those for, 20 years now. The VA hospital system has had acupuncturists in the hospitals for about 30 years now.
Wow. No, that is just exciting. It's just exciting that it's really coming more popular and recognized, and it's been around for so long, and people are finally just seeing the benefits of it. From a safety standpoint, how do you ensure cleanliness and proper practice during the treatments? And are there any risks or side effects?
So safety, like I said, all the needles come to me individually packaged in sterile containers. So I don't unwrap my needles until the patient gets there. And then I wash my hands, obviously, before, during, and after. And then with the patient, I just clean the skin with alcohol. So clean skin, clean, sterile needle. And as far as the risk, there's really only if my patients are on blood thinners or if they're elderly. If somebody, is up in their years and they have really thin skin, they bruise very easily. And so I will switch to what's called a Japanese needle, which is it's a higher gauge, which means thinner needle, but it also has a different taper on the needle. So all that means is it's not as tough on the skin. So if someone's on blood thinners, they can absolutely still see me. The only side effect to that, they might get a little tiny bruise, and it's tiny. And a lot of times they don't even bruise, but they're going to bruise more. So maybe bruising. And then the only other side effect is really lightheadedness. If patients don't eat a little before or after, they might feel lightheaded after their session. That's from the blood sugar trying to kind of normalize with the high dopamine. And so I have to be a little bit careful with diabetics. With their blood sugar. So I always tell my patient, you got to eat. So hydration, eating, just let me know if you're on blood thinners. But other than that, minimal risk.
And it's great. You have snacks just in case for those moments.
I do have snacks. Yes.
What has been your experience like with the cancer patients, since this is something new that they have now at Bryan with treating chemotherapy patients? Have you seen any side effects or anything?
No.
To that extent?
No.
Oh,
no,
that's great.
No side effects. Neuropathy is stubborn. If somebody's been getting chemo and radiation for years, there might be their second bout of treatment. It's harder to get ahead of the neuropathy. Sometimes the acupuncture, I can make it better, but it's not going to go away. So with neuropathy, it's interesting. And I think that's true of any neuropathy treatments, regardless of what treatment you're doing. The sooner we can treat the patient when they have the first sign of neuropathy, the better the outcome. And as far as everything else, absolutely, it helps with their nausea is something that responds immediately. I've had patients, in fact, I had a patient, she just had her chemo pump out. Then she comes right to me because normally she would feel really sick that entire day. She comes to me right after the treatment. And then she gets off my table and there's no nausea. It's just gone. So nausea responds very quickly to acupuncture. So it definitely helps with nausea. Then she doesn't have that day downtime. Then she's like, oh, I feel pretty darn good. And then she even eats that day. So it really helps with their appetite too and their energy.
It's so important during that time, especially when their immune system's so down.
Mm-hmm. Yeah.
I know you were talking about the training and everything with the doctors that, become MDs and get a certification and with your licensing. What kind of training and licensing is required to become a certified acupuncturist?
Acupuncturist, if you have an LAC, licensed acupuncturist, LAC behind your name, that's a master's degree. And so you have to come in, well, not anymore. That's changed. I graduated almost 30 years ago. You had to have your prereq. So most of us came in with a health science background, like A&P, even nursing, PT, biology. I came in with biology. But you have to have all the prereqs, obviously focused on health science. And then it's a 3-year master's degree. A lot of the schools have added PhD programs. That's an additional 1 to 2 years, depending on the school. So a lot of the new students are just staying for an extra year and getting their PhD. So it's a 3-year post-grad program.
Oh, wow.
Yeah.
So what drew you into this field and what keeps you so passionate about it after 25 years?
Well, I came from a biological background, actually veterinary laboratory science, believe it or not. But I ended up in Alaska, and there was nothing in my field and in veterinary medicine as far as pharmaceutical lab research. So there was a hospital that was more of an integrative hospital. And I thought, well, I can work in the lab there. So I worked in the lab, and it was very holistic, really ahead of its time, very progressive. And they had a lot of acupuncturists on staff at this hospital. And so I had chronic pain in my neck from a bad water skiing accident when I was 16, and nothing really helped. And I started getting acupuncture. And I couldn't believe how fast it helped, and then the pain went away. So I thought, well, that's interesting. There's something to this medicine. So then I just became interested in the medicine, and I thought about becoming an acupuncturist for several years until I decided, I'm going to do this because this is my personality, the way I was raised. And I was raised in a very holistic family. My grandparents were organic ranchers outside of Beatrice. And so I grew up with, natural health, non-invasive, first and foremost. And obviously, if you have to go, into drugs or surgery, but let's try something a little more conservative first. So that's how I grew up. My grandmother on the farm was an herbologist, and she didn't know it. I mean, she gave us dandelion tea. I thought everybody had dandelion tea for a sore throat as a kid. So I already had that base, and then it helped me so much that I moved from Anchorage, Alaska to San Diego and went to acupuncture school.
Wow. I have been taking dandelion tea for years.
Yeah, see,
but I only use it like once a day, if that. I mean, not to overuse it, but
exactly.
It's been a great holistic way.
Exactly.
What do you think? How does acupuncture complement other forms of care, like the massage therapy, the physical therapy, traditional Western medicine? I know you touched a little bit about that earlier, but
yeah, I look at it like we're really treating the same thing, just different approach, because we all have our specialties. And I am a team player. I like to draw. I've always worked with massage therapists. When I lived in Boise, Idaho, I worked with 25 physical therapists. We tag teamed all the time. And so when a group of practitioners can work together, it's always a better outcome for the patient. I've never been territorial. If I feel like I'm not making enough headway, or I need to bring in a chiropractor, say a pinched nerve, I'm going to be working on the soft tissue and the inflammation, but it feels like that rib head's out or the vertebra's out. That's chiropractic. So we all kind of come at that pain from a different angle. Once I can get my patient out of pain, then they need to strengthen. Then they go to PT. So it's all of us. And then even with Western medicine, I always come back to this, but if you have what I call a chronic complex pain patient, that patient might have to stay on their meds. But with acupuncture and massage, maybe they don't have to be on as many meds, or the dosage can be less. And so it's not one or the other. I think the true integration of Eastern and Western medicine, again, that we have both available, the patient, it benefits the most working together.
And that's how healthcare really should be, is one team, one mission.
Exactly.
For the patients. And that's truly what I hope comes together with the world. Are you seeing any new trends or exciting developments in the world of acupuncture in 2025?
Yes. So we kind of talked about chemotherapy patients and acupuncture, but now the push really, and it's mostly at cancer hospitals, is trying to, instead of wait until after the series, of chemo or alongside the series, let's do it at the same time as the infusion. So some acupuncturists now, you're on your chemo pump, you're getting your infusion for 2 to 6 hours in the infusion bay, and then you're getting acupuncture either at the beginning of that treatment or the after, whatever works. For 30 minutes, you stay in there. So acupuncture at the same time as the infusion. That's where some of the it's like, this is the better outcome for patients we have found. And then we kind of talked a little bit about just different types of medicine, which this is really intriguing. Veterinary medicine. More and more veterinarians are getting certified in acupuncture. Many, many, many. In fact, even in Lincoln, because I had to take my dog to different vets, and one of them said, well, we can do acupuncture. And I said, well, then I'll do it, because they didn't know I was an acupuncturist. So many vets are getting certified in that as an addition to something extra they can do. And then even my dad, who's a cattle rancher, he has a livestock veterinarian that she does acupuncture on my dad's cattle. So they do it on cattle, they do it on racehorses all the time. They've been doing that for years and years and years, because they can't use drugs on the racehorses. So wound recovery. So that's much more of a push. It's pretty common that veterinarians now have an acupuncture license. And then the other thing with post-surgical patients, many doctors thought, well, after surgery, let's wait like 4, 5, 6 months before you can go to acupuncture. Well, by then, the scar tissue is already formed, and maybe it's formed improperly. So now the doctors, a couple in Lincoln, are saying to me, oh no, 6 to 8 weeks. I want you to start to work around that. I want you to get that scar tissue, because that's what's holding up the mobility. And it is case to case. If I'm doing any post-surgical patient, I do need a physician's referral, and I work closely with that physician for a timetable. But that timetable has come way up. Used to be like, don't treat for 4 to 5 months. Now it's like 6 to 8 weeks. Let's start acupuncture. It helps with the recovery too.
Definitely.
Yeah.
I mean, the more they move and
exactly
get going.
And then the only other thing is there's been a lot of mental health professionals, psychologists and psychiatrists are now hiring acupuncturists in their office. And so those two go together really well because of the dopamine and the serotonin.
I can see where that goes hand in hand with, especially with our huge mental health rise.
Exactly.
If you could bust one big myth or clear up any misconception about acupuncture, what would it be?
I think the number one is most people assume it's painful. And that's why they don't want to come. Because even my close group of friends here that I grew up with in high school, I said, I can't believe you gals have never had acupuncture. And they're like, oh my God, it will hurt. Oh my gosh, it's going to hurt. It's going to be so painful. How can that not hurt? So I talked them into it. And then they're always so surprised. They're like, well, I didn't even feel that. That is definitely the biggest myth, that it's going to hurt. But rightly so. I mean, if you don't know anything about it, most people assume that it's a much bigger needle, and it's actually a needle, not a thin wire.
And probably if you're Googling and seeing pictures with a bunch of needles all over someone, you're like, oh, that looks painful, but it's actually really relaxing.
Exactly. Yeah. And then the other, I get this mostly, well, I guess I get it from patients and providers that, wow, there's no scientific data for acupuncture. It might work, but there's no data. There's so much data. There's so much data, there's so many, and you can pull up the whole clinical trial and it's, 50 pages long. You can read it, but there's a lot of data.
I think that's another 1,000 studies.
I think that's another misconception. Well, if there was just some science behind it, there's a lot of science behind it now. So I think those are the two big ones.
Is there anything else that you can think of that you'd like to cover?
The only thing, you don't have to have, a diagnosis. If you want to come see me for a consultation, those are always free. But some people will say, I don't really know, I want to experience it, but what do I come in for? I mean, most of us have stress. And so it's a really good tool to use just for stress of our daily lives, and treat it like maintenance, prevention, as part of, so kind of like a massage, if you get a massage. So come once a month. And because we can kind of reset all those neurotransmitters, the hormones, just get things flowing, calm down the muscles. So just use it, as a preventative, so you don't get to that point where something does happen. I think that's any questions, people can just call me at the clinic. or email me any questions they have.
I will definitely be linking your information below on the podcast, so people can come and get a consultation or even get an opportunity to talk to you about that. Betsy, thank you so much for sharing your expertise and heart with us today. It's clear that acupuncture is not just a healing art, but a way to empower people to take charge of their health in truly transformative ways. For listeners who are curious about acupuncture or maybe considering it for themselves, Betsy's insights remind us that healing doesn't have to follow just one path. Sometimes the best outcomes comes from blending traditions and meeting people exactly where they are. If you enjoyed today's episode, make sure to subscribe to Go Ask a Nurse, leave us a review, and share this with anyone who might be looking for new ways to support their health and wellness journey. Until next time, take care, stay curious, and keep asking questions. Be blessed.
The information provided on this podcast is for general informational and educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or health concern. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. The views expressed by guests on this podcast are their own and do not necessarily reflect the views of the host or Go Ask a Nurse.